Health Minister Dr. Joe Phaahla says he expects to make recommendations about the current state of disaster to the National Coronavirus Command Council. That's next week. It's been almost 2 years since the state of disaster was declared to curb the spread of COVID-19 in South Africa. We're joined now to reflect on the past 2 years by Wits University Chair of Social Security Systems Administration and Management Studies. That's Professor Alex van der Heever. Thank you very much, Prof, for joining us this afternoon. As I take a breath and reflect on the past 2 years, a lot comes to mind. Perhaps let's start with this because there's a lot to dissect, I guess. Did you ever think that after 2 years this is where we would be?
It was very difficult to tell 2 years ago what was going to happen because you didn't really have a clear picture of the severity of the disease itself and how it would actually end up transmitting globally and domestically over time. And I think it was very difficult to understand what it would look like, even though the flu pandemic of sort of 1919 gave us some idea.
And back in December of 2019, China had already, seen some cases, and we were just looking at this train coming for us. But like you say, we had no idea. Perhaps let's take a look at when the state of disaster was enforced. In the beginning, a lot of criticism. Well, it wasn't criticism, I guess. It was comfort that we're doing something. Criticism started to trickle in later on when we were starting to feel the impact of a harsh lockdown. When you take a look back, would you say that was justified?
I think that first lockdown was a mistake. Certainly we could have looked at restrictions, but what was apparent very quickly was that this was going to be a virus that's going to be around for quite a while, and that it would involve multiple waves. And this was apparent in March of 2020. And under those circumstances, you're not going to gain much by a complete shutdown of the economy because you're still going to have another wave and another wave and another wave. So the question really is, how do you find a way of mitigating the spread of the infections until you get to some sort of vaccine? It wasn't clear. The world had never also run at developing a vaccine with such speed before. And so it was also uncertain as to when we were going to have that as our key prevention method, because really nothing else was going to work effectively. So we did need to put in place some restrictions, but the harm to the economy has had knock-on effects on people in South Africa that really are so vulnerable that you can't afford to do this. And the economic impacts are too great for a country like South Africa. So you do have to look at a different approach, and I think that was apparent very quickly, and it was a very big mistake to introduce the level 5 lockdown.
Do it, we did. And then you have the element where the state was burdened with cushioning these vulnerable people or cushioning vulnerable South Africans, as you put it. What complicates the matter even further, or what is more puzzling, is that monies that were meant to, go towards making sure people's lives were not only a little bit secured, but to make sure that there's PPE in the country, to make sure that healthcare workers are able to do their jobs, was then embezzled.
Yeah, this is one of the most shocking aspects and revealing aspects of really the South African state at this point in time. It looks very clear that the state is basically primed for corruption. And that means that the moment you modified procurement rules slightly to deal with an emergency, they were exploited for all they were worth everywhere across the board, multiple departments, including the National Department of Health. And this was done at a time when we actually had no effective protection for frontline health workers. I can't imagine what people were thinking they were doing. And so this was so incredibly harmful. But it shows that there's something fundamentally wrong with the way a large part of our state is operating, and it needs to be cleaned up. This really does need to be changed. But it was in place and to some people invisible. COVID made it very, very clear, and the SIU has made it very clear. But for many years, the Auditor General has also made it very clear what's going on. But this was a shocking part of it, and it also showed that the key parts of our state that should have been focused 100% on addressing this pandemic in the interests of the public were not focused on that.
But wait, there's more. I think I go back to a time when I see a plane. I think it was India when we started the scramble for getting vaccines in the country. What have you made of our assessment of that? Much fanfare was made about it. The media was out there. Everybody in the country was looking forward to seeing, the goods that were on this plane, only to find out that, some of them had expired already. How have we dealt with that?
Yeah, so there's quite a story to the poor beginning of our vaccine strategy. The first thing was that in 2020, government basically didn't do any work in preparing the vaccine program. We needed to ready the system for it so that we could vaccinate at least the healthcare workers as soon as possible as we go into a third wave. But what happened was government had done nothing. They hadn't procured vaccines, and they hadn't actually created a rollout plan. So a lot of pressure was put on government to get their act together in January of 2020 and December of 2020 and January of 2021. Then they started to move, and so the fanfare came because they'd been pressured to now procure something, and they went to India for the AstraZeneca vaccine, imported 500 doses. Now, they weren't expired at all. They would expire by April of 2021, so there was ample time to distribute them. But a clinical trial showed that they weren't totally effective in preventing infection from what was then the beta variant that was predominant in predominant in South Africa. Now, the problem with that decision was that it probably would have been effective against severe illness because it operates on different parts of the immune system. And this was made clear over and over and over again. But we threw away those 500,000 vaccines, and we didn't procure the additional vaccines that were going to be made available to us. We gave them away. And so we waited. And so we were only rescued to some degree by the Sisonke trial, which gave out about 500,000 vaccines to healthcare workers. And it wasn't a government program. That was a trial. This was a real mess. And probably if we'd begun even with the AstraZeneca vaccine in January of 2021, we would have saved many lives. But even that initiative was on the back foot. But ultimately, the vaccine program did take off, but with a big delay. And what you really want to do is get the vaccines out there before each new wave and each new variant comes through. And unfortunately, we only started to get most of the population vaccinated through the third wave. And by that stage, we'd experienced substantial mortality. And many people had already been infected. So by the time the vaccine program comes in place, we're vaccinating people, some of whom have been infected 2 or 3 times. And so we have emerging immunity in the system, but not because we were successful, but largely because people got infected. And we have massive mortality. We have over 3 football stadiums of people who have died, over 300,000, which is catastrophic. And that shows that we pretty much prevented nothing at the time when we needed to actually try and keep infections low. But we really didn't have anything to deal with it because basically the state wasn't capable enough to create programs that could prevent infection in areas where people were very high risk, densely populated areas, townships, taxis, people in bulk transport, all of those areas, we essentially let people get infected.
Professor van der Heever, very quickly for us, it couldn't have been all that bad, especially when you take a look at our numbers or the way we have handled it as compared to, European countries and the amount of deaths and infections that we are seeing them still grappling with. So it couldn't have been all that bad, no?
No, it's been terrible. You're looking at South Africa's reported COVID deaths. When you start to examine the excess deaths, that gives you a picture of what really happened. So we report 100,000 deaths, but actually we have 300,000. And when you compare it to, let's say, the UK, a country almost the same populations, but bigger, they had over 100,000 fewer. So we actually did experience very, very severe mortality. We really got hit by this. Now, but that question now of reporting is a very important one because, in fact, information was not disseminated adequately during this period. A lot of information has been kept away from the public. And government has actually refused to officially accept that excess deaths are COVID deaths, despite the fact that most reasonable countries in the world have done that in their countries. And they've done that because it does make the figures look bad, but the figures are bad, and you have to show it, and you have to face up to the fact that we didn't do well in this area.
Unfortunately, that's all the time we have for this conversation. Thank you very much for availing yourself. Professor Alex van der Heever is with the University of Witwatersrand.